Welcome back to Successful Aging Radio with your hosts, Drew Schlossberg and Paul Menard.
I'm Drew Schlossberg, the Community and Public Relations Director for the San Diego Union Tribune.
And glad to be. I'm Paul Menard, and I'm just sitting by his side watching him. That's all I'm doing.
Oh, listen, we are happy to have Mr. Radio with us, as always, at our second annual Union Tribune Successful Aging Expo presented by Humana and Cox. We're here at the Town & Country Resort and Convention Center, and happy to have with us some good folk from PermaDontics Center, Dr. Ian Ayers. He is a prosthodontist. I know I pronounced that wrong, and we'll have him do it the right way. Dr. Ayers, thanks for joining us.
You're welcome. Yeah, it's prosthodontist.
That's right. He did this on purpose so we could throw something. And what exactly does that do?
Okay, a prosthodontist is a dentist who has additional training in prosthetics. So we specialize in replacing missing teeth, using crowns, bridges, dentures, and obviously today implants.
Implants and implants have taken a major jump in the last 15 years or maybe even more than that. But I mean the fact that it's a very accepted thing now.
Well, it's a very successful treatment, and the results now coming in to show how high the success rate is, and that's why we're recommending them more and more to our patients.
How long have you been doing that?
Well, I've been doing implants as such since 1984.
Oh, wow.
And so we started with what was called the Brandemark implant system, which was using 5 implants to restore a full lower jaw. And that was based on Professor Brandemark, a researcher out in Sweden. And since then, we've refined the technique. Because when they first came out, implants were designed so that they needed to heal for 6 months.
Oh, my
you had
goodness.
to wear a denture for 6 months. Now, today, what we're able to do is to put the teeth on the same day. We actually call it same-day teeth.
Right.
So
it's amazing.
So that patients can leave our office with teeth permanently attached to the implants.
Well, back in the day, and that's where I go because of my age, but back in the day you lost the tooth and say goodbye. Well, you could build a bridge and all the other things, but it was, there was a point to where if you lost certain teeth, you couldn't even build a bridge anymore, so there wasn't any hope.
Right.
And then all of a sudden this comes along.
Right.
And how would you, as opposed to dentures, you get to a certain point with people, and you may as well take out the rest of the teeth, yada, 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 and just wear dentures. This is really the savior to that, is it not?
Yeah, well, dentures are really difficult to wear. A lot of people don't even wear their dentures. They keep them in their pocket and only wear when they have to.
Right.
And dentures really only have 30% chewing efficiency of a natural tooth. Okay.
30%?
30%.
Oh, my goodness.
Yeah.
I've heard that before.
Yeah. So putting an implant in really feels like your own teeth again.
Yeah.
And you actually have the same biting force that you can with your own teeth.
Most insurance companies cover this, yes, no?
No, most insurance companies are not covering it.
Right.
They consider it a specialty. They consider it an elective procedure. Unfortunately, they're not covering it yet.
Right. But, to your point, Paul, it is just so popular, and obviously Dr. Ayers and his colleagues have just so much experience in this, and you only work on implants, and I'm assuming that, once you have the implant, you're good to go, and that's it, correct?
Well, yeah, the implant does take time to heal.
Right.
Okay, so, once it's healed,
right.
We tell our patients to go on a soft diet for 6 weeks.
Uh-huh.
And after 6 weeks, they can eat normally, and they're good to go, and we actually guarantee the implant for a lifetime.
It's really affixed to the jaw, is it not?
It is. The bone sees the titanium like a normal type of material, and it grows onto the titanium as if it was its own bone.
Right.
And once it's fused, that's it. It's in there.
Strong as a tooth.
Very stronger than a tooth, actually.
Stronger than titanium.
Yeah.
Better porcelain. Yes, indeed.
Yeah, no, I know certainly anytime you are working around the mouth and doing these types of things, that we're talking to Dr. Ian Ayers. He works with the PermaDontics Center and a prosthodontist. I actually said that one right, I think.
You did.
Very good, at least for the ones who could hear this over here.
Your dentures didn't fail you that time.
You know what? To be honest with you, my dentist is he says he's actually jealous of my teeth because it's got strong bone. He said you're never going to have any problems with your teeth as long as you do what you need to do with it. But that being said, obviously probably a little discomfort when you do the procedure. How could you not, right?
Well, what's interesting is that we're always surprised at how little discomfort our patients have. You would expect to see pain or to have the patients experience pain, and we give our patients pain medication the day of the surgery.
Sure.
A lot of the time they come back the next week and say they didn't need to take the pain medication.
Wow.
And what's interesting is that the pain mostly comes from the gums.
Right.
Okay, if you have pressure on your gums, it's painful. But because we're putting the implants in and then setting the teeth on top of the implants, there's no pressure on the gums. because the pressure is now distributed to the implants, which are in your bone.
Right.
And so that's one of the reasons that patients have very little pain.
Right. Now, is that are other people doing that, or is that sort of a science you guys have perfected?
Well, what we've perfected over the last 15 years is what we call the same-day teeth, so that patients don't have to wait the 6 months.
That's amazing. It really is to hear you even say that.
And what we've also done is we've eliminated having to do bone grafting. A lot of patients have been told they don't have enough bone for the implants. They need to have bone grafting done. It's going to take 6 months for it to heal. And then they have to put the implants in and wait for that to heal.
Right.
And so we use a 3D model. In our office, in the PermaDontics Center, we have a 3D scanner. So we make a 3D model from that scanner, and we actually do the surgery in advance on that 3D model. And we know exactly where the bone is, so we can position the implants in the exact position. We know the diameter of the implant, the length of the implant. And so when it comes time to do the surgery, we have everything planned ahead of time. And we position the implants in the ultimate position and then attach the bridge to that.
Insert tab A and slot B.
Right.
How do you get that 3D image of the jaw to be so exact?
Okay, so the new technology is it's called stereolithographic modeling, and that is it's the scanner is connected to a milling unit, and the milling unit builds up the bone incrementally, millimeter by millimeter, until we get an exact duplicate of the patient's bone and whatever they have left, if they have some teeth left as well.
Whoa.
And so we work with that. We actually articulate that model onto their other teeth, and then we do the whole thing in advance on that model. And that's, I think, that's one of the big differences that we have here at the PermaDontics Center that I don't think you could see anywhere else in California anyway.
Right. Wow. Isn't there a myth, Dr. Ayers, that you could be too old to get this implant?
No, the only reason that you wouldn't want to do an implant is if you were really ill. Okay. And age really has no bearing on it.
You can be 45 or you can be 85.
Well, we just did an 88-year-old gentleman a couple of months ago, and so we don't want to treat people who have diseases like uncontrolled diabetes, or if they have very high doses of cortisone for some reason, or if they're very ill. So we check that out, but otherwise it all depends on the bone. If you have the bone, and we'll find it, and we can do it.
Wow. That's just amazing. I came very close to doing it at one time, and the problem was that there wasn't sufficient bone, and we got into the bone growing thing, and that's when he lost me. I don't want to hear any more of that. But
when we tell patients they need bone grafting, they just walk out the door, you see.
Yeah.
And so with this new technique, we're able to see their bone on the 3D model and utilize whatever bone there is.
It just depends on the length of the root, right? Would that be right?
Exactly.
Simply?
Exactly.
Yeah.
And oftentimes, we're able to do implants where dentists previously have told the patient you don't have enough bone.
Right.
But now we see it 3D, and we actually can handle it and position that implant in the remaining bone.
How new is this technology? It's cutting edge for sure.
Well, actually, the 3D models have been around for some time, but they haven't been as accurate as they are now. So
not
only
when they mill it like you guys do.
Right.
Yeah.
So only in the last 2 to 3 years have they become very accurate, where we're able to predict that when we put the implants in the bone on the model, that it's going to be the same in the patient's mouth. And that's pretty new. That's about 2 to 3 years.
I was going to say that's the thing that.
And the other new thing is titanium. So we use titanium now to support the teeth. Previously, we would have to use gold. The problem with gold is when you cast the gold, it would shrink. And then to get a really good fit, you need to section the gold in pieces and then solder it back together in order to make it fit. With titanium, we have a block of titanium that is milled with a CAD/CAM machine. So now we get a very accurate one piece that doesn't have to be cut. So we get a full one-piece titanium bar that will fit over all the implants in what we call a passive fit. So it doesn't bind. When you have a bridge put on and you first put it on, it's tight.
Yeah.
This is not tight. This goes in perfectly. It fits perfectly. We call it passive.
Well, it's just amazing to me.
Well, the technology is amazing.
Yeah.
We're talking to Dr. Ian Ayers. He is a prosthodontist at the PermaDontics Center. How long has the organization been around?
We've been around for about 3 years, but Dr. Berg and I have actually been working together in this system for 15 years now in separate offices. Now we built a center which is dedicated just to dental implants.
Yeah, exactly. Are you seeing all ages come to you? I mean, it doesn't not just seniors.
Really all
age, right.
Really all ages. And we'd be surprised. We have people in their 20s and 30s who are missing a lot of their teeth already. And then people in their 80s who are missing their teeth as well.
And, if you're someone out there that's listening that's considering dentures, maybe you should look at this first. Much better situation.
Well, yes, and we give them patients a free consultation, and we can tell them exactly what we see on the scan, what kind of bone they have.
What you have to do.
And we give them their options.
Okay, well, you can't. Why would you not want to do that?
Well, are you kidding me? You'd want to do it in 5 seconds if you had to do that. Hopefully, you wouldn't have to do it. But if you do, this is a great place to do it. Well, just wanted to thank you so much for swinging by. Thank you for supporting our Successful Aging Expo. Hopefully, we'll see you here next year.
Oh, very much appreciate you having me on.
Yeah,
Thank
you have a website people can go to?
We do. It's called PermaDontics.com.
Very good. So, listen, I'm going to get that thing all teed up over here.
I must ask you, is that a South African accent?
It is.
I thought it was.
It is, but it's 32 years ago.
It's like a Boston accent. You never lose it.
Right.
It's still there. Well, thank you so much, Dr.
All right, you're welcome.
Dr. Ian Ayers from PermaDontics Center, chatting about dental implants. And, Paul, just another interesting session. I got to tell you that right now.
It really was.
Yeah.
Educational. Thank you, Doctor.
Absolutely. You're listening to us live at the second annual Union Tribune Successful Aging Expo presented by Humana and Cox. You are listening to Sign On WS Radio. We are San Diego's online radio.